What kind of doctor is best suited for this field of sports medicine?
Sports medicine is such a good branch as there is no emergency.
Where do you think this branch will be in next 10 years?
So job opportunity is pretty good. You can get absorbed like this.
How much principal amount is needed to start your own private practice in this field?
You should not invest so much of money in your private practice.
You see your seniors harassing you or making it more toxic.
They used to come, tore my file, some slap, pulling up the collars. उससे भी ज़्यादा मारते थे. The workload was even worse.
But this harassment leads to what?
Because they want me to work for 22 hours, which is not humanly possible.
How much can a sports medicine surgeon earn in India? Immediately after completing his degrees, 10 years down the line, 20 years down the line. We are building India's largest community of medicos. And thank you to each one of you for making it a possibility. But I still have a complaint, guys. 85% of you are still not subscribing to the channel. So before I move forward, introduce today's podcast guest, I would request you to press the bell icon and press the subscribe button. There's also one piece of info I would like to tell you. I want to create something for our medicos. So if you are facing any problem with your university, your authorities, and you do not want to come forward, simply make a post from any account, tag me, and I will be the person to tag all the government authorities and make sure they know what's happening on the ground. I am going to devote my life to the service of our doctors because they deserve justice, they deserve respect, and they deserve an environment where they are not assaulted. Let's move on to the podcast now, guys. So today we have a very special guest. He's a leading orthopedic surgeon who specializes in sports medicine, sports surgeries, and regenerative medicine. He has an amazing career. He has learned sports medicine from Safdarjung Medical College. He has done his post-graduation of orthopedics from Grant Medical College. And if I start telling you his fellowships, it is going to take me a minute. So I'm going to use my phone now because it is a lot. So he has done his shoulder surgery fellowship from Milan, sports medicine and arthroplasty from Paris, sports injury HSS New York, and regenerative orthopedics from Germany. He's a model who is currently very, very fit. I think body fat percentage less than 10%. He is a fan of anti-aging medicines and he's done a lot of research in that field, and we are going to discuss everything about it. He's one of the leading pioneers to have been nationally recognized for ACL repair. He's none other than very, very fit Dr. Manu Bora. Welcome Dr. Manu to the Nachiket Bhatia Show.
Thanks, Nachiket. Nice to meet you.
Same here, boss. Boss, sports medicine is a very fantastic career opportunity because,
True.
it combines the fascination of sports and medicine together. So that's the topic that we are going to discuss with you today. But before we get into that, I would like to know everything about your journey. You are a sports injury specialist. You are a model. You model for Raymond. And of course, you are fit at the age of 43. And I'm sure, guys, that you have not, he doesn't look 43 at all. So I think we want to know everything, how Dr. Manu Bora came into the field of MBBS and, chose a career path that you are onto today.
So basically, I was born in Jaipur, and that time, what I could see in that city is that the career paths are like quite a few. So my mom is a doctor; she is a gynecologist. So I thought, okay, doctor is a good field to choose because at that time, either you become a doctor or you become an engineer or maybe an IS officer. Then you go to army, but there was no those kind of fancy jobs like MBA and all of the business development. These are the new kind of jobs which are there now. I think at that time, I thought okay, doctor is a good field to be. But then when I was in medical school and I used to see a lot of sports person, they get injured. And getting back to the sports is so difficult for them. Nobody ever could get back into the sports. There were a few reasons. First, the doctors at that time in India were not well trained enough to do sports medicine surgeries, basically. They are good orthopedic surgeons, but the sports medicine is a newer branch in orthopedics. So the training was not good. After the training, the rehabilitation is extremely poor because we don't have sports medicine PG. Is still, the sports medicine PG is very recent, and that time there was no sports medicine PG. The physiotherapist doesn't know what to do with the sports person. They know only few movements, how press the pillow, only few exercises. So the treatment was bad. So that's why I chose to become an orthopedic surgeon. And because sports is in my heart since a long time. I want to do something for a sports person as well. So after my PG, I went. I did my PG from Bombay, Mumbai grants, and then I did my sports medicine from Safdarjung Sports Center. And after that, I went around the globe. I got trained in USA, in Paris, in Italy, and then I got a knowledge for sports medicine surgeries, and that's how it started.
Boss, how did you get into modeling?
Modeling is my hobby. So I used to think that okay, I should become a model when I was in school. But then I also know that the modeling is a very short term career and very unstable. So in 1 month you are earning a lot, another month you are doing nothing, and the shelf life is pretty small. So I thought, okay, first do my education first, and then will start the modeling. And I did my PG from Bombay. So once I did my PG, I completed my PG. Then I started doing modeling. So I got fit first, got my portfolio. Then I sent my portfolio to the agencies which were there in Bombay. Then one of the agencies, which is the India's finest, Anima Creatives, they signed me up. And after they signed me up, they have sent me for Paris Fashion Week and Milan Fashion Week and all of these countries. So I've done modeling internationally as well in Paris, Milan, and New York. That's how it started.
Doctor and a model. Don't you think there's a huge uh, space between these two professions?
It's difficult, no doubt about it, because there is no shortcut. Now I do modeling very less. I do only for Raymond, so now it is very manageable. But when I started modeling, I was doing the job as well, and I was a junior doctor that time, and I was pretty good in modeling as well. I was doing all the fashion week in India, all the big brands, going international as well. So managing these two professions is not easy. I used to work double. Double means that if I have to do 6 shoots in a month, suppose, then I used to do 6 nights also. So I used to do night and then I get a day off after that. That's how I used to manage my holidays. Otherwise, it is difficult that you can't, how you can tell your hospital that, okay, I'm not coming for 7 days a month. It's not possible. So I used to do my night duties, and on that next compulsory off, I used to do modeling.
What kind of doctor is best suited for this field of sports medicine?
What kind of doctor who wants a good life? Because the sports medicine is such a good branch, as there is no emergency. First thing. Second, all the patients are very young, so there is no complications. The surgeries is very small. Like all my surgeries happens in maybe 1 or 2 hours maximum. Like I don't have to operate for like 12 hours like liver transplant. It's not complicated. Simple surgeries, they are technically challenging. I understand, but it's a long learning curve. You can learn, but the life is very pretty nice. Every sports surgeon in this world is doesn't stay in hospital for long hours. He is the one who is taking maximum holidays. He is the one who is going hiking, marathon, everything. So if you want to have a good life, if you want to enjoy your life, then sports medicine is something which you should consider. But yeah, it comes with a cost. It is one of the highest ranking field. So you need to be super good in your field. You need to have super good ranks in the examination to get sports medicine. Otherwise, you will not get it.
What were your days like when you were learning about this field? I think you have done this thing after completing your orthopedics, right?
Yeah, orthopedics ke baad sports medicine.
Yes. So what was your learning days like?
So orthopedic learning days was horrible because I did my PG from Grants, Bombay. So Grants, Bombay comes under this JJ Hospital. It's one of the oldest medical school, GMC. The PG was so tough that in the first year, it was like hell. I used to sleep only for 2 hours in whole 24 hours. So constantly working without any sleep, without any bath. The hygiene condition was very bad. We used to sleep in the ward itself. I didn't get any time to go to the hostel to even for taking a bath or a sleep. I used to go to my room once in 10 days, maybe in the initial days. So it was very tough. Sports medicine was okay because I did my sports medicine SRship in Safdarjung Hospital Sports Unity Center, one of the finest teaching institute in India for sports medicine. And we have a lot of SRs, about 17, 18 at that time. So, and I used to do modeling as well. And only work there was joint replacement in sports medicine. So it was easy. So not that tough. But yeah, after that I went for fellowship in other countries. That also means sports medicine is cool. It's not tough.
So would you say you saw a lot of toxicity in your post graduation days?
Yeah. A lot of toxicity. So the reason was immense amount of patient load, and there was only 4 seats of PG at that time. Now there are 24. So you can see the difference. We were doing all the work, and we were only 4 people. in one batch. Now there are 24 people are coming. So now the toxicity has reduced a lot.
Did you see your seniors harassing you or making it more toxic, something
Yeah,
like
yeah,
that?
yeah. Physical harassment is very common. They used to come, tore my files, some slaps, pulling up the collars, bad words. Yeah, it was very common. It was very
So
common.
was it common in that time,
It was
or
very common in that time. Yes,
and it was like कि ठीक है ये तो होता ही रहता है?
everybody was doing it. We also did it to our juniors. So, but the environment was like that. Means I'm not very proud that I used to harass my juniors, and I used to get harassed by my seniors, not letting me sleep, making me do jogging in the operation theater. Like you imagine, like I was working for 22 hours constantly. I'm not joking. 22 hours means 22 hours, and there was this night OT in my hospital. Obviously, I was very tired, right? No sleep at all. So my senior was operating, and I was sitting on the stool, and he saw that I was sitting on the stool. You first year, you don't know how to behave. Are you sitting? Stand up and do jogging. He used to make me jog in the operation theater while they operate. One day I was, because of so much of extreme pressure, I was putting notes in the night. So obviously putting notes in, I was so sleepy. So I started putting, okay, the vitals are stable. And then wrote idli, dosa, sambar in the notes, right? Because my brain was so foggy. I was constantly working. That was in my mind because the food, right? Working and there was no food. For the food also, we have to order the food because there was no time that I should go to the canteen and eat sitting. No, I can't do that. There is no luxury for that. I used to order the food. The food boy used to come from the hotel. They used to put in the ward. And whenever I get time for 10 minutes, I used to quickly eat. And then next day morning, there was rounds and they were checking my files and that was written, idli, dosa on the notes. They tore all my files. So these are like the common practice at that amount of time. But not now. Now the things have changed.
Do you feel that kind of trauma affected you later in your life?
Yeah, it made me harsh, I guess, in my work. Because orthopedics especially, not other branches, but orthopedics especially, the surgeons are quite arrogant in the OT. Why? Because I think the training was so bad at that time. Now I can think the future will be good. Now there is no much of harassment. The problem is there was less seats and more work. What to do?
That's the only problem.
What else? You need to get all the work done, and there are only 4 people in one batch. Ideally, there should be around 24. That is so there was huge gap in the population and the doctors. Now the gap is filling up.
Is the scenario like this in all the Mumbai colleges or JJ especially?
Mumbai is worse for surgical. Not now, but that time, KM was the worst. Then the JJ and then the Sion.
KM में क्या होता था ऐसा?
उससे भी ज़्यादा मारते थे वो. The workload was even worse. KM was the biggest. Seats was the lowest. And you have to think that these are the colleges and the orthopedics is the topmost branch. So all the cream students used to go there. And then all of these harassments used to happen.
But this harassment leads to what? What are these seniors trying to prove with this kind of harassment and toxicity?
Because they want me to work for 22 hours, which is not humanly possible. So they have to make me work by this.
डरा के धमका के.
Otherwise, how it is possible? It's an 8-hour job. Is what? You need to work for, like, now I have my own company. I have many physiotherapists, orthopedic surgeons. Everybody is there in my company. Nobody works after 8 hours. Everybody wants to go home. And if you want to make someone work for 22 hours, then what are you going to do? You're going to harass them, right? You're going to punish them.
Did you used to do their work also? Seniors का भी काम करते थे आप?
Seniors का काम is only to operate and see patients.
That's it.
Obviously, my work is to do files, to do putty, to do dressing, to manage all the patients. And there are so many patients and the doctors were so less at that time. But I think that was everywhere in Bombay. So it was like, okay, that is normal. What to do? You can't leave your PG because you got it after, like I was ranked 65 All India. To get ranked 65 All India in...
It's not a joke at all.
Yeah.
Seriously.
Rank 65 is tough. And then you can't leave it now because you have worked for 5 years to get that rank and position.
Sometimes when I listen to these stories and I feel sad. कि इतना ज़्यादा हरासमेंट, इतनी ज़्यादा टॉक्सिसिटी के बाद जब कोई निकलता है ना, ऑफ कोर्स आई बिलीव
I
दैट
don't
देयर इज अ
feel
प्रॉब्लम.
I don't feel sad. Now I remember it and I laugh. Yeah, because we have faced it, right? And it is not something. Yeah, that time I used to cry, but now the only thing I remember about my PG is these moments.
I'm sure that on Twitter and everything you might have read a lot of new postgraduates complaining, okay, that there's toxicity, because sometimes the toxicity is that the people, the seniors to them are asking them, ki, okay, order food for us. Second is asking them to make them overtime. What is your advice to them?
Overtime, obviously, it was overtime, but then is the government problem? Is not the my seniors' problem. The government should have done it correctly. They should have appointed more doctors. They want to save money. Is their problem? Because if there are 100 patients in an ward, who is going to manage them? There are only 4 doctors. So either they die or I work. My seniors were also working very hard. They have to operate more. They are not,
Sitting idle.
yeah, they're also not sitting idle. But then once these kind of environments start building up, then they become more toxic. Then few of the seniors are like super toxic. Then they don't want to torture you. They will make sure that I do the plaster at least 10 times in a night because they're not liking it. Oh, this is not correct. This angle is different. Oh, there is a small dot here. The bone is not aligned. It's 95% aligned, but yeah, you have to be 100%. So they make me repeat the plaster 10 times in a night. I have to apply a plaster, cut it. Apply a plaster, cut it. They used to repeat the x-rays many times. It's not correct. Now it is 46 degree. You have to make it 50 degree. Now how can I say what is 50 degree and 46 degree? The bone is inside the thigh. I cannot measure it. And even if I measure it, there is no proof of, means I can't prove because he is seeing with his own eyes. He wanted me to repeat the x-ray 10 times because I have done some mistake.
So boss, what does a typical week look like for you as a sports injury specialist when you were working, basically after getting your degree, when you were working? What was your typical day like? Clinical hours, family time?
So my typical nowadays, I can tell you that I wake up around 7. Then I have my own clinic. Though we have a gymnasium in my own clinic because we do a lot of post-operative rehabilitation. Is a rehab center and a physiotherapy centers. So I go there. I train with my trainers. We have physiotherapists, sports medicine experts, yoga teacher, nutritionist, strength and conditioning coaches. And then 2 days I sit in Gurgaon, Monday and Wednesday. 2 days I sit in Delhi, Tuesday, Thursday. I think I get free by 4 or 5 at the max. 2 Friday I go to Bombay, month mein twice. But I get free by 4 or 5 all the time.
So ample of family time.
Yeah, then I'm free.
Boss, which institutes would you say are the best to learn sports medicine in India?
I think in this sports injury center is pretty good if you want to learn because there is a lot of cases which are happening. Otherwise, you can go to individual doctors who has a good practice. So there's fellowships under many doctors. We also have a fellowship program running under us. So these are you can go to these institute or you can do DNB also. FNB sports medicine is there right now in few institutes, which is very good. So there is FNB. So there is a difference between an orthopedic surgeon doing a sports medicine and a sports medicine PG. A sports medicine PG is recently started. They have their FNB and PG as well. Both of these things. First PG and then the FNB you can also do in sports medicine. So there is no surgery involved in sports medicine PG. But if you're an orthopedic surgeon and you want to practice sports medicine, either you go through DNB FNB or you join a fellowship program or you do SRship under the institutes in which arthroscopy is happening. The sports injury center, I think, is one of the finest in Safdarjung Hospital near AIMS.
Overall, this field has not got the traction it deserves. Why are people not choosing it in that kind of manner, the way they do medicine, surgery, or let's just say orthopedics? Why are people not shifting towards sports medicine?
Sports medicine is not a good branch. Sports medicine surgery is a good branch.
Okay.
If you are opting for a sports medicine PG, you are a better physiotherapist because you are not operating. When you are not operating, then in India it is difficult. A sports medicine after an orthopedic surgery is an orthopedic surgeon who is operating for the sports injuries. So this is the difference. We are not a sports medicine PG. I'm an orthopedic surgeon who is trained in arthroscopy. That's why I'm practicing sports medicine. Sports medicine PG is someone who is got the PG after MBBS, and they have better knowledge of the muscles and everything. So much better course than a physiotherapy course. And I think the demand for sports medicine will rise, but still it's not that good. The payments are not good after they come out of the PG.
Boss, where do you think this branch will be in next 10 years? Sports medicine
Sports
surgery.
medicine will not be. Sports medicine surgery is the topmost now, also, and everywhere in the world. If you want to do sports medicine surgery, after orthopedic surgery, if I want to pursue sports medicine in US, I can't get it because MLE will never let another country student to give those prestigious field. So sports medicine is topmost everywhere after orthopedic surgery. Yes,
Where do you think 10 years? 10 years down
it
the
will
line?
be topmost.
Same.
Yeah, robot might come.
So what do you think AI will be like in this field?
AI is helping us a lot also. AI is helping us to get the rehab protocols and everything. And I think AI is going to be big in every field. How this is going to shape the industry, I can't say right now. What is the role of robot in this? I have not seen any robot in this. We have not seen any navigation still in the sports medicine. So robots and navigation are there in joint replacements, but still they are not in sports medicine. I think scientists are working towards it. Let's see.
But 10 years down the line, do you think robots can replace you?
Replacing doctors will be a bit difficult. Right? We have to sit somewhere and do the surgery. Na? So I will be doing surgery at my home. That is going to happen. Like after 50 years, yes, maybe I will get replaced, but my practice is over then.
Like, what is the experience of a sports surgeon, let's call it sports surgeon, in the field of corporates? Where does that career opportunity take them?
See, sports medicine is still a new field in India because the older orthopedic surgeons are mainly the most famous ones still are the joint replacements. So because the joint replacement surgery volume is huge, so in every joint replacement unit they need someone who can do a sports medicine. So job opportunity is pretty good. You can get absorbed like this because most of the units, most of the senior surgeons are into joint replacement and they want someone to do sports surgeries for them. So corporate, you get quick job.
And what about the government sector? Maybe government colleges, all right, government hospitals.
Government hospital have orthopedics as a branch for the job vacancy. And if you know sports medicine or if you have an interest in sports medicine, then you can develop your branch in the government setup. Like every government institute is now doing some kind of arthroscopy. But then the problem with the government setup is that they have a different kind of patient which is not economically that sound, right? And sports medicine, if you talk about the implant cost is higher, is quite costly when you go for a very advanced surgeries. So I give an example like the ACL surgery implant will cost from 20,000 rupees to 2 lakhs rupees. So the 2 lakhs rupees implant is obviously more advanced, more research and developed data is there. And those kind of implants will not be used in a government setup. So sports medicine is growing, but then the good implants are not available for everyone.
So basically, you need to have a patient set which is from a higher income group.
No, if you get a lower income group, then you use the lower income group implants. If you get higher income, you choose the higher costly implants. Implants are there. These are all American and European companies. So we have range of implants. Someday the implant cost should come down. I don't know when. But now
You have started your own private practice.
yes.
All right. What would be your advice to a new person new doctor who has just completed his sports medicine surgery from, let's suppose, of the Jung? I mean, how much should he or she wait before starting his or her own practice?
No, they can start their own practice
Shouldn't
after
they
one
take
day
some
also.
experience before or directly to the practice itself?
That depends. If somebody has done a SRC from SIC, Sports Unit Center, or they have done their FNB from SIC, they don't need to do anything else. They are fully trained. If somebody got trained under someone where there was no hands-on practice, yes, they need to do some further trainings. But it is always good to do some kind of fellowship outside the world so that you know what the other countries are doing, all the developed countries. Second thing, giving results is not surgery. Surgery is one part. You will get results only when you make patient to do exercises for at least 6 to 9 months. This is not there in any other surgeries. Every other surgery, the exercise protocol is only for 15 days, 1 month, maximum 2 months. In sports medicine, any kind of surgery, minimum 6 months to 9 months. So you need to know what kind of exercises they have to do. And as a surgeon, we don't know anything about exercises. I can't expect any surgeon to read about exercise because this is not field. So if you are practicing sports medicine, you need to have your own rehabilitation experts, or you get some tie-ups with the good rehabilitation experts or centers. That is important. Otherwise, you will never get result. And rehabilitation of sports medicine is even a newer field. So only few physiotherapists in India knows about it, who are experienced. Most of the physiotherapists doesn't know how to do a post-operative rehabilitation for ACL reconstruction or maybe PCL or shoulder injuries. Then the repeated injuries is very common, re-injury and re-tears.
Well, let's suppose a doctor needs to start his own private practice for sports medicine. How many members does he or she need in his team to start a successful practice?
I started with one physiotherapist.
All right.
Now we have 6 physiotherapists, 2 strength and conditioning coaches, 1 yoga, 1 nutritionist, 1 psychologist. So it's a big team now. So you start with one. You start with one. Then gradually build as you have more practice and more practice and more practice. Yeah. You start with one. But that one should know how to do rehabilitation after the surgery. And there has to be some system to remind the people again and again for 6 months. So what we do is, it is very difficult because we get patients from all over India, because I have my own YouTube channel, which is quite famous in ACL surgery. So I get queries from all over India, all over world, in fact. So we get patients from everywhere. And it is not possible for every patient to follow up with us every week for 9 months. Is not possible. So we do online rehabilitation when they are not coming. So my team remind them every week. So I get a lot of patients who got operated elsewhere and just coming for rehabilitation, because online rehabilitation is also very crucial, because offline is not possible for everyone. Everybody has their own job. Even someone who is residing right next to my clinic, they don't want to come to my clinic every week. But exercises are a must, otherwise they will get re-injury. So one physiotherapy is enough, and online rehabilitation is important.
So that's like a non-negotiable. You need to
Yeah,
have a physiotherapist.
otherwise the result will not come. There will be huge chances of re-injury and re-tears, and patient is not satisfied.
And normally, let's suppose, boss, it's a very good thing that you have a YouTube channel, because it leads to a consistent level of marketing. And you have a very big YouTube channel also. But if a new doctor is starting up, how can he reach out to patients? Because unlike any other field, this is a very niche field. People still, a little bit apprehensive of going to sports medicine, because they think, ki, acha, मैं तो sports person हूँ ही नहीं. That is what general public thinks. No. How do you solve this thing?
No, general public thinks that मैं a sports person नहीं हूँ, but whenever he has a injury, like if somebody has a ACL injury, they are not going to search for a sports medicine doctor. They are going to search for ACL surgery.
They're going to search for orthopedician first.
No, ACL surgery, whatever the injury is, they are going to search for their problem, not for orthopedics also. You go to the YouTube, you don't search orthopedic surgeon. You say, okay, ACL surgery, what is going to like? Can I heal the injury without surgery? So YouTube is always good. Like, you have to start some kind of social media platform if you want to build your practice. Then if you have a corporate job, then it becomes easy. Then the whole corporate marketing is there. And now the Indian people are also very smart. If somebody has a injury, they are going to search a good doctor for that injury.
But isn't like orthopedics taking up already half of your cases?
No. We are not different. We are orthopedic surgeon.
No, I got it. But after orthopedics, being a sports medicine specialist, every sports injury should come to you, but it does not. Half of them are already tackled by orthopedician, and because they have a very high number already, people tend to go to them.
If somebody knows how to operate through arthroscope, they will never miss a case, right?
True.
So if I'm a surgeon, orthopedic surgeon, if I'm doing a general practice, like say I'm not in Delhi and Bombay, I'm in Patna or I'm in Jaipur, and I say, okay, I will only operate sports medicine. No, I can't survive. Why? Because we cannot gather so much of cases in those small cities, right? So we have to do general practice. In general practice also, there are people who are very good in sports surgeries, And if you're not good in sports surgery, you're going to call someone who can do the surgery for you.
True.
So surgeries are always good. So I have never seen, see, if a surgery fails, then they will come to us because we are someone who are on the, like if one surgery failed, the second surgery failed, then they're going to search for the best doctors. And there will be around 20 doctors in all over India for sports medicine. I am also one of them. So they will come to me for sure. And whenever I see those failure cases, very rarely I find out that there is a surgeon's mistake. There is no surgeon mistake. Because surgery, everybody learns the surgery and then they do it. They can't do wrong surgery. The mistake is wrong rehabilitation, poor implant choices because of the socio-economic things. So these are the two factors. Not getting updated.
Was you were talking about fellowships abroad.
Yeah.
Which fellowships do you recommend a new sports medicine specialist, which they must do if they want to succeed in this field?
So there are different kind of fellowships which you can apply for, and there are different kind of scenario. One is that if you want to do fellowship in USA, there is one very big route that you clear USMLE, and then you give step 3 also, then you appear for a match, and then you wait, and you might not get fellowship in a first go. You can get some clinical, non-clinical fellowship, and then switch to clinical fellowship. This is a very long path. Second easy path is that you can find out who are the good doctors through internet, through conferences, because now in conferences also so many people are coming, and in these conferences there are fellowship vacancies for the new students. They can apply. So these fellowship are short-term fellowships, 3 months, 1 month, and basically these are observership, not fellowship. If you are already doing practice in India, you know how to do arthroscope, you know how to operate through arthroscope, then you just need to go and observe what they are doing. Nobody is going to teach you hands-on. So if you know how to do surgery, then you go outside and see what they are doing and you start doing it. Otherwise, if you want a clinical fellowship, hands-on fellowship, then it's a long path. It's not easy. You have to give examination, you have this and that. And then most people doesn't come back after that.
What was so special about Safdarjung?
Sports Injury Center is one of the unique kind of center where they have only sports medicine surgeries are happening and joint replacement. And all of like the director now is my teacher, Dr. Deepak Joshi, initiative Dr. Deepak Chaudhary. Both are very fine surgeons. So they teach fine surgeries. The treatment is on the notch, and they have lots of hands-on because the volume they generate. So I think those are the institute which are pretty good if you want to learn, or you can come to us. We do give a lot of hands-on because of volume. I operate around 60 to 70 surgeries in a month, so it's a good volume a student can see.
It's a very good volume.
Yeah.
If I simply talk to you about a flaw in the system, even till now, we checked basically the research that most of the big corporate hospitals do not have a structured sports medicine department. Why do you think this is?
Because India is still growing. It will come someday. Because to have a sports medicine department like a sports injury center is very expensive. Like you have very good doctors in all the corporate setups who perform wonderful surgeries. The department comes with a rehab center. And to develop a sports medicine rehab center, it's a costly affair. It needs a very big space. And to generate that kind of business for the very big space is sometimes difficult. They want to have this space for other fancy robots and urology surgery. They don't want to give space for the physiotherapy. Physiotherapy department is very small. So I think it will come someday, but when they start developing a good rehabilitation, because surgery is happening, doctors are there, the sports medicine department is there, fully fledged. You cannot upgrade it. It's already very good. Now the rehabilitation is the missing part. So you need a big rehabilitation space and experts.
So any reason hospitals are not investing in that?
I'm telling you, the revenue is less and it's too expensive. How can you expect a bigger hospital to give such a big space just for physiotherapy when they are charging only for 2,000 per session?
So basically the costing needs to increase. This is what
if cost will increase, then who is going to afford it?
ये भी बात है.
So the profit model of a rehabilitation center is not that great. See, I have a big rehab center. I'm not making any profit from it. It is just for my good results. My
It's a
practice
part
is
of your
growing up.
treatment.
Yeah, my practice is growing up, and I get to means I also train in there, so I feel good. So now presently I have the best training anyone can get from a best sports medicine experts, from the best sports physios to the strength and conditioning to the yoga. So everything is helping me also as by see health is the best investment which I can make for myself. So this center is making me super fit. I don't care about profit and making my patients super fit.
Like
So
that's a great sentiment, Dr. Manu.
yeah,
I
yeah,
mean, I really agree with you on this thing. Health is the best investment.
yeah, health is the best
The
investment.
day India understands this, because I personally believe India doesn't celebrate health.
Yeah,
इंडिया में क्या है, कौन सी गाड़ी में आ रहे हो ये मैटर करता है, आपका चाहे इतना बड़ा पेट भी हो बट गाड़ी बड़ी होनी चाहिए.
नहीं अच्छी गाड़ी में घुस नहीं सकते बड़ा.
The boss, I'll ask you the most important question, the most requested question of our podcast. How much can a sports medicine surgeon earn in India immediately after completing his degrees, 10 years down the line, 20 years down the line?
As after PG, I think they can earn around 1.5 to 2 lakhs rupees easily a month. 10 years down the line, I guess the number should increase if they have a good practice. If they stick to corporate, should around 15 to 20 lakhs a month. And after 20 years, the figure should reach around 30, 40 a month.
And how much can they scale up with their clinic? I mean, if you know somebody who scaled up the clinic to the maximum level possible.
You need to open your own hospital, then maybe you reach a crore mark as well. If you have your own hospital and everything.
So it's a good field.
I am telling you, it's not about money. It's about happiness. We don't see death. We don't see depression. You see a branch like oncology, high paying job. But then all the patient died. Most of the patient get some kind of disability and eventually they die. So patient satisfaction is poor. So this branch is so good, not because of the money, because of the freedom you have. No emergency. Nobody dies. Young patient, they don't stay in hospital. They come, they go back. So you don't have to keep seeing them every day. Oh, the hemoglobin is going up or down, or what are the blood markers? Like after joint replacement, the surgeon's heart is like dig whole night. Some Mataji is going up, some Mataji is going down, somebody is calling, oh, the Mataji is not nice, some pulmonary embolism happening. So it is a stressful field medicine. So that's why sports medicine, leave money, but you will be super happy.
That's also a good factor.
And you see all the athletes, you want to be fit. I have never seen an unfit sports medicine surgeon. Rarely. All the big surgeons in India right now in sports medicine, they do marathon, they do hiking. They are super fit. They are super happy. They don't stay in hospital at all after 3 or 4.
They have a very good afterlife also.
Yeah. No doubt about it.
Boss, what's the most famous patient that you have treated?
You have seen this elephant whisper who got
Yes.
Oscar.
Yes.
So Kartiki was my patient. We operated her some cartilage transplant and these kind of shit. Now she's fine. She's shooting again.
So, boss, give me a ballpark figure. Now we're going to talk about private practice. How much principal amount is needed to start your own private practice in this field?
You should not invest so much of money in your private practice. You can start with your own small clinic. Like I started with one shop and then one physiotherapist and one reception and one coordinator. So this is the minimum setup.
What about your OT?
Operation is, I was in Artemis. So I was in corporate setup.
All right. Let's suppose you want to build your everything on your own. A private practice with an OT, with a rehab center maybe.
Then see, you cannot survive a hospital only on basis of sports medicine. So it's a general hospital you open up as a sports surgeon, you will operate your sports injuries and orthopedics. And there will be other hospitals, other surgeons and other specialists will also be there in that hospital. So, but if you are in a corporate, then is what you need is a small space to see the patient and physiotherapist. So what I want to say is that you should have your own physiotherapy team. You should not be dependent on other physiotherapy institutes or maybe hospital physiotherapy department. You should have your own.
And you can do the OT and everything in the corporate setup.
Yeah.
Because that's a big cost also. That's a big cost also. And if you try to build your own.
Yeah, try to build your own is a costly affair. Is a building up your own hospital. But then I think you can join any other hospital. Joining a hospital is not hard. Everyone wants a sports medicine doctor. And then you can have your own clinic. But even if you don't have your own clinic, the first employee should be a physiotherapist who is going to take care of patients. Because surgery result is only dependent on what they do after 6 months.
Very true.
So get a good rehab expert, physiotherapy expert is important.
So, boss, you have started a new startup on anti-aging.
So I researched a lot about anti-aging. I am reading about this. I have read a lot of research paper, listened to many of the experts in this field, and there are so many good supplements which are there in the market right now. So one is NMN. So after 30, your NADH level drops. NADH is the main energy source for mitochondria, and NADH is important for your gene repair. So we get a lot of DNA damage every day, and it get repaired. That's why we stay young. After 30, the NADH level goes down, and our DNA repairs somehow diminishes as the age progress. So the cells are not getting repaired; they are dying. That's why we get aging. We get wrinkles, the hair falls, the weak bones, all the diseases and everything. So NMN is going to boost up your. The only molecule in this planet is NMN, who is gonna boost up your NADH. So NADH is gonna go up, and your repair is gonna start again. So that is pretty good. You should have NMN around 1000 milligram once a day after 30, I believe. Then we have many antioxidants like ALA, polycosanol, green tea extract. So basically, these regulates the sugar spikes, so you don't have many sugar spikes. These are helpful in building up good muscles. Also, they are helpful in having your cholesterol on track. So these are the anti-aging substance. So we have made this longevity pack by Reverse Clinics, and these supplements I have made for myself. So because I want to eat them whole of my life, so I've manufactured it myself. I've done it this dual testing from other labs for its purity. So NMN, ALA, and quercetin, these are the combination which is going to give you a longevity boost, less of diseases, more of energy, good sleep with magnesium and everything. And it has to be taken after 30. Then we have weight management pack, which helps in your weight loss. So it has chromium, green tea extract, and polycosanol. So these three also act synergistically in reducing your weight, but not by fat burning. It's by fat getting good metabolism of the fat. LDL will go down, HDL will increase. Your muscles are gonna use more of the fat cells. These kind of things.
So great, boss. All the best for your startup.
This is for you.
Yeah, thank you so much. You already look very, very young. You look younger than me. So I don't think this is for you. I think this is somebody like me itself. But thank you so much. I believe the startup is going to change the world. Something very new, something from our own Brian Johnson. So thank you so much. But the podcast has not ended till now. We still have some sweet, pretty questions. The rapid fire for you. So rapid fire के बहुत सिंपल 2 रूल्स है बॉस. यू हैव टू बी सुपर स्पॉन्टेनियस, सुपर ट्रूथफुल. तो आपसे हमारा पहला आएगा. व्हाट्स योर रेड फ्लैग एंड योर ग्रीन फ्लैग?
Red flag is meat and animal products. Green flag is green, vegetables, colorful.
Which city changed the way you think?
Goa. I love Goa. You just go there, chill in the beach, have a relaxed life. Maybe someday I'm going to settle. Stop operating. Just want to sell supplements and yeah.
Which country's culture fascinates you the most?
Indian. I love India. I've been to many countries in Europe and US. I was doing modeling there. I stayed there for a long time. I was doing my fellowships there. But somehow I like Indian people. I like surrounded by Indians. If I am someone, I'm a doctor, and India has made me a doctor. So I have to serve Indian people. End of story. I love them.
What's one question you think that people should ask you more?
How to prevent injuries?
I think the
how
question
to
should
stop
be
aging?
how to stay more fit.
How to stop aging? I am now into injury prevention, anti-aging, more of in prevention of injuries and disease rather than treating it. We have to see all of the medical education is driven by pharma industry. They don't want the disease to end. Every research, every treatment, every single word in my books which I have read is to how to treat people when they are diseased. I was not told how to prevent it. how to prevent it without medication. So now I am doing my own research, and there are wonderful doctors around the globe who is making good research in it. And I keep on reading them, and through my channels in YouTube and Instagram, through reverse clinics, we spread a lot of awareness to how to prevent injuries, how to prevent disease, and stay young, stay fit. Why you want to pop up pills and go for surgeries? Don't do that. Follow
India
us.
should learn from you how to stay fit. That's the message I want to communicate to everyone.
Yeah, I have a cartilage injury in my knee, in my patella. I have a retrolisthesis. I will show you my X-ray. You will be surprised. I have a severe retrolisthesis, anterolisthesis in L4, L5 with a big disc. But I am doing all my activities quite fine because I maintain my muscle strength. I do good amount of training under guidance. I don't know how to train myself because I'm a surgeon, but I have good support team with me, sports physiotherapists. They train me, so I'm able to function without the surgery. So that is the thing, that you need to think beyond the box, and definitely you can prevent surgeries in many diseases. You can prevent many diseases through right food, right supplementation, right amount of exercises, and we are there to help you out.
Let's make India better, boss. Thank you so much for today's discussion. You have explained sports medicine, surgery in a very detailed aspect. So thank you so much for that. And thank you guys for watching today's podcast. I believe everyone who was fascinated by this particular career option, you have got every question of yours answered. And of course, you have got some very good tips from the health icon here. Anti-aging, how to stay fit, what the diet should be, and do not forget, plant protein is the way to go. Thank you so much. And before you exit, do not forget to like, share, and subscribe. Thank you, and God bless you.